we were at the LHIN board meeting yesterday morning, and we did a presentation so jointly Rob Byron and myself did a presentation to the LHIN board dealing with the motions that our board had passed last week, which you saw on the web, etc., or on the internet. And so we presented to the board, the LHIN board, recommending approval of the planning framework. The LHIN board considered that, asked us a few questions, and passed a motion in support of that. And basically there were three things in the LHIN motion. The first part of the motion was approving the planning framework. So we've got the go-ahead to start doing due diligence and stakeholder engagement about the potential for a merger. The second part of the motion was that they agreed that we should roll motion 1B, which was to do with the maternal-child integration, under motion 3, so the timetable for that is now consistent with motion 3, and it will be considered as part of the due diligence that we will undertake. And then the third part of the LHIN response was they actually put a timetable, or a deadline, more to the point, on when we need to present to them a integration plan for maternal-child, and they have asked us to provide that by March the 31st, 2014. The one other thing they said was that we've got an extra 30 days to mid-November to conduct further due diligence and stakeholder engagement. So, long story short, the bottom line is we're now off and running on looking at the potential benefits for merging with the Scarborough Hospital.
Okay.
That's where we're at. Any questions?
I was wondering when this merger is going to happen.
If the merger happens, the decision would be presented to the LHIN board in mid-November, mid to late November. At that point, if they were to support it as well, we would have to get permission from the Minister of Health, because the only person that can approve a corporate merger is the Minister of Health. So we can recommend and say this is what we think should be done, and that can be supported by the LHIN, but the Minister actually has to approve it personally. So given that, I think the reality is, plus we will have to go through formal due diligence, engage external legal counsel, engage external accountants to conduct the financial due diligence. The reality is it would probably not be effective before April 1st of next year, March 31st, so we'd probably start on the new fiscal year. And in terms of the reality of when things really might start to happen, it's going to be well into 2014. John?
So could you just reiterate that it's business as normal until that's at time? In other words,
absolutely.
Keep doing whatever we're doing.
Absolutely, yes. Great point. So it is business as normal. So let's not start taking the foot off the gas pedal. We've got lots and lots of things to do. We will be implementing collaborative care. We will be implementing the new bed map. We will continue to hire new physicians and hire new staff as we need them. So day-to-day business goes on. Please focus on that. The burden of the due diligence will primarily fall on the management team. If you're providing service to patients, continue to provide the great service we're getting a reputation for delivering, please. Yeah, great point, John, thanks. Yeah, Laura.
As someone who's involved in one of the larger change initiatives in the organization, how does the senior leadership team look at managing the changes that are going on in our organization?
So how do we fit, if it's business as usual and we've got all these other things going on, how do we fit that in with whatever the eventual decision is around the merger? So the reality is we can't predict. We don't know that we're going to merge yet. So to try and guess what the result is would be inappropriate, which is why we've got to focus on what we continue to do and need to do on a daily basis. In terms of bed map, as I said to the question over here, it's going to be late 2014 before we even really start to think about implementing anything in the way of potentially service changes if we go to a merger, or even if we just decide to do some lesser level of integration. So we've got to get on with business as usual, and we'll deal with, we've got to do further changes in 2014, 2015, 2016. We just have to deal with that then. The reality is, even if we don't merge with Scarborough, even if we don't do any further integration, which I think is unlikely, we're going to do some form of integration, even if we don't merge, we're going to be going through constant change anyway. I mean, if most of you, when I look around, have been around this place for the last 5 or 6 years at least. So, it's hard to remember a day when change hasn't been occurring, because we've been doing a lot of things. So, change will continue.
What does due diligence look like?
Due diligence, we've got to look at the fit of the two organizations, what are the legal constructs. We've got to do the financial analysis, so we need to understand what the financial positions of the two organizations are today, and frankly, what are the financial opportunities that a merger presents, because we've got to know that there's a benefit to this. If it's going to cost a whole whack load of money and there's not a lot of other sort of ancillary benefits out of it, we're not going to be merging. So, we're not going to merge just for the sake of merging. There has to be a value proposition coming out of it. So the due diligence is really about understanding the as-is situation of the two corporations and understanding what the value proposition is going forward if we were to merge. Martin?
Just last week, after listening to your last town hall, there was a lot of rumbling at Ajax because you haven't determined us as an island on our own, and I think that's how he said it a couple of times. Anyways, people were concerned. I think if you could just reiterate to people, I think they can hear it not enough, that Ajax is still going to stay with Rouge Valley. That was a buzz for a day or two.
Ajax is part of Rouge Valley Health System. Ajax is not being spun off. Ajax is not going away. That is the commitment of this CEO and the board of the Rouge Valley Health System. So that's the position we've taken. It's been agreed to at the Integration Leadership Committee. It is enshrined in the planning framework. The planning framework specifically says we will not be impacting any frontline patient services at the Ajax Pickering campus as part of this process. And as I think I also said in the last town hall, that doesn't give you a free pass in terms of general restructuring that will be going on, but we're not going to be moving services from Ajax to Scarborough. That help, Arden?
Thank you.
Anything else I need to say about that to make everybody happy? No, seriously, I mean, it's important because if the message is getting misinterpreted, I need to be able to correct that, and you need to tell me that people are hearing something different than I'm intending. So thank you. Hi there.
Can you really hold on to that position?
Question is, what happens if the LHIN says, or the ministry says, actually we've changed our minds and Ajax has to go with Lake Ridge, or Ajax is on its own, or whatever. Well, the reality is the LHIN doesn't have that power to amalgamate or de-amalgamate anything. They could do the same thing as they've done here, which is to say we want you to look at amalgamation of Ajax with Lake Ridge. And if that's what they say, that's what they say. They're the funder. And if the minister says this is what you're doing, then we would do it. The reality is they're not going to do that. The politics wouldn't drive it in that direction. So I think that's so remote a concern, it's irrelevant.
I don't know if you want to comment on the island on its own, with respect to the fact that it's
Health links?
the distribution of clinical activity.
Yeah. So yeah, going back to the terminology of sort of island on its own, that was really talking about protecting the frontline patient services at Ajax, and not saying we're going to look at the 4 hospital campuses rather than the 3 hospital campuses. So that's where that drove from. The other thing that came out of the LHIN meeting, which was actually separate from this particular integration agenda item, was the LHIN did talk about health links, which was actually very interesting. And they have approved the creation of 7 foci or 7 individual health links within the Central East LHIN. 3 of those are in the Kawarthas, Peterborough, the far east. But they're creating 2 health links in Durham, one in East Durham, which is centered around the hospital component of the health link, will be Lakeridge. They've created another health link in West Durham, the hospital component of which will be Rouge Valley, Ajax, and Pickering. And they've created 2 health links in Scarborough, one in North Scarborough, with the Birchmount as the focus of that health link, and one in South Scarborough with Centenary and the General as the 2 hospital campuses as the focus of that health link. So I think that was quite interesting in terms of hearing that presentation pretty well after this, because for those of you who've got any familiarity, health links are this is the new. I have to be careful that I'm not pejorative in my commentary here. This is the new model that is being proposed for helping to pull together the delivery of services around high risk and high use patients. So there's evidence to suggest that 3 to 5% of the patient population in the province is using somewhere in the region of 30+% of the dollars associated with healthcare. And there is a view that if we can organize the system more effectively to respond to those patient needs, we can actually drive down the cost by providing better quality. This is a ministry initiative. It was announced October last year, September, October of last year. They provided some seed funding to about 15 or 19 organizations to create these health links. This is the Central East LHIN's next process. We don't know whether there's funding to support any of these health links. Actually, there is to support one, because Peterborough was one of the first ones, and they did get some funding. The other 6 that are going to be created in the LHIN, we don't know whether there's going to be funding. And what they're going to try and attempt to do is bring primary care and the other components of the health system together to focus more effectively on this high-risk population. So that's the idea behind health links. Okay, great question. So if we were to merge, or if we are to integrate, are there any programs that have been put aside or taken off the table? And the answer to that is no. If we are merging, then it would be everything we do would be merged. The 2 corporations would come together under a single governance, so a single board, single management structure, and then the services would be rearranged as appropriate. If we do not merge, if we are unable to demonstrate a value proposition for merging, but we can see opportunities for clinical integration at a different level, or integration of any sort at a different level, whether it be back office or what have you, then we will look at that and see what it is. But again, everything is on the table, with the exception of, as I said before, especially for Ajax, frontline patient services at Ajax are not part of this deal. Yes?
I was wondering how efficient would be the management when you're managing 3 hospitals at the same time? Like, how does that get affected?
I'm not sure it has any impact. There are much larger organizations being managed by single management teams than these would be. I mean, UHN is still going to be larger. They've got, I don't know, 7 or 8 sites. So I don't think the management structure is an issue. The question was, is this being finance driven or patient care driven? And the answer is it's yes to both. In part, it's in response to the overall funding situation for healthcare. We know we've got constrained funding going forward through to 2017 under the provincial plan. So that's a reality at the provincial level and the provincial budget level. From the individual hospital corporations' point of view, we clearly have a challenge to manage within that constrained funding environment. But if it's just about money, it's not going to work. So we've got to be able to see that there is a real access and quality value proposition to support it. So we need to be really clear that that this would allow us to maintain access in that constrained funding period, because we need to be able to continue to serve the 1 million+ people that the two hospital corporations are responsible for, and we need to be able to look at improving quality. And there's always opportunities to improve quality until we get to the point where we are delivering error-free medicine.
We heard that there was an expert panel appointed to look at the Scarborough Hospital.
So the question is, there was an expert panel appointed under motion 1A to look at the Scarborough Hospital's plans for moving its services around under its strategic plan refresh, which was really focused on finding ways to balance its books and deal with the access and quality issue. That panel reported last week. The report was issued to the Scarborough Hospital Board and presented to the Scarborough Hospital Board last night. Yes, last night. The panel report pretty well didn't agree with much that the Scarborough Hospital had planned to do. That was the reality of it. I can't tell you whether it has any implications beyond that for us, because I haven't got through to Appendix 3, which you tell me I need to review, Michelle. So I've only read the headlines, and it didn't seem to have an immediate impact on us. But Michelle says I've got to read the appendices, because apparently there's some interesting stuff in the appendices. So I've got to get back to that, and I don't have the answer. But I mean, to the extent that it impacts maternal child services, and we know maternal child services is still a big issue for the LHIN. Whatever they've come up with in terms of those recommendations, we're going to have to take that into account in the planning for maternal child. And I suspect it will be an indicator of things we need to think about for any clinical services planning or restructuring that we do in the longer term. So yeah, I'm sure it'll have some impact. Margaret?
When do you anticipate some of this work happening or starting for all the work groups?
Yesterday. Literally, yesterday. So financial due diligence is actually underway. John's team has been working on that with their counterparts at the Scarborough Hospital. They've been working through collecting some of the baseline data now for 2 or 3 weeks. We're in the process, there's a meeting this week for the facilities group to get up and running, because facilities is going to be a big issue for the 3 Scarborough hospitals. Particularly, it's less of an issue, or it's not particularly an issue for the Ajax campus, because we've spent just about $100 million refurbishing that campus and expanding that campus. Of the 4 hospital facilities, it's probably in the best shape of them all. So finances will be a big issue. Sorry, facilities will be a big issue.